Hi, my name is Khurram Malik. I'm one of the founders and CEO of Biome Grow Incorporated. We're a Toronto-based cannabis company, we're primarily with domestic operations in Atlantic Canada. And what you'll see from us later on this year is our international focus, which is where the bulk of our business will come from in the future. Certainly. So what's interesting about our company is we've designed it to be a very efficient platform. And what it is, from a small footprint, we should be able to secure very large deals that generate very large cash flows without having to spend hundreds of millions of dollars to secure these deals. We're regulatory specialists. We've helped build some of the largest cannabis companies in Canada, so we know how to sort of navigate the supplier side of things, but also the demand and offtake side of things to develop a really efficient platform to achieve these things. Certainly, we're just getting started, but we're vertically integrating from day one, which is unusual. Typically, you do one thing, then you forgot to do the next thing, and then in a couple of years, you find yourself being vertically integrated. But since we've been working in this industry a long time and helping build these vertically integrated platforms, we know how to do some of these things simultaneously at once because we know where the pitfalls are and where the pivot points and the points are to do it quickly and efficiently. So stay tuned. Hopefully, if we do our jobs properly, we'll be one of the major companies in the next year or two. Our long-term business strategy is to export the Canadian cannabis way of doing things, or shall we say the Canadian brand, overseas, where primarily will be known as a medical cannabis platform globally, with production assets, retail assets, regulatory assets, educational assets around the world, in addition to Canada. Canada is just where we got started and where our home base happens to be. It's very important. We prefer the medical market to the recreational market. The margins are thicker, there's greater barriers to entry, there's more things you can innovate on the medical side, and it gives you more sustainable control of your destiny on a go-forward basis where there's actually a lot less competition. The entire world's coming out with medical programs, not recreational programs. I'm often famous for saying that there are only 36 million people in Canada. It's a small market, it's a great market, but it's only a starting point for us. It's the hundreds of millions of people in medical markets is where the real prize resides. Indeed. So it's in the early stages, which means no one's quite established the right way of doing things. So what we try to do is identify gaps in the system in terms of where opportunities are being ignored and fill them. So in Canada, that happens to be building provincial brands. In overseas markets, that happens to be first or second licensed producer into these large international countries and helping establish the regulations and how a cannabis program will be run in these countries based on what we've learned in Canada. So that's how we sort of get started, having an interesting niche in Canada, but being first in the door into these very large countries which are just coming online with very vibrant medical programs.